commemorated the 60th anniversary of the NHS with the publication of the Next Stage Review. It may have been written by a surgeon, but I hope you accept it's not a manifesto for hospitals, because it's in primary care and the community that we can best address the inequalities that Chris was talking about and the lifestyle diseases that could overwhelm the NHS if left unchecked. The academic Barbara Starfield shows that countries which invest more heavily in primary and community care are healthier, more equitable, and spend less on secondary care as a result. Promoting health and well-being and tackling the causes of poor health lies in the capable hands of primary and community care professionals. Improving commissioning of health and social care services is a challenge that healthcare systems across the world are facing. Although there are encouraging signs, we still have a long way to go in improving how professionals commission services that meet patient needs and are of consistently good quality. Practice-based commissioning shouldn't be something that a few practices do and the rest just talk about. We recognise that we haven't done enough to support practice-based commissioning, and that PCT should do more to encourage practices to get involved. For the first time, through world-class commissioning assurance, PCTs will be held to account for how well they support practice-based commissioning. In essence, I'm delivering this speech to the wrong audience, because the Alliance is such a progressive force for good within the NHS and within, particularly in primary care. You not only know the route, you've actually cleared a great deal of the undergrowth for us.
What we see our job at the centre of doing is creating an environment where you can go out and improve services for your patients, where you can take power and make things happen. Our job is to help create that environment, to provide you with tools and help you build capacity. But the evidence shows that the way you really get change across the system is to absolutely support the leading edge. Support, reward the risk takers in the system. Support and reward those people who are absolutely driving to the very edge of what's believed as possible in the kind of service that we work in. We need to do that in a significant way. It's one of the reasons, interestingly, that when we went through the primary care strategy, we focused our attention on what is described as the practice-based commissioning escalator, which talked about integrated care organisation, the leading edge. It's exactly where we need to focus our attention and reward risks at that end of the process. Absolutely vital. We all know that to get real change on the ground, particularly between clinicians and managers, you need trust and understanding and relationships. And they do not build up overnight. It takes time and effort for those to happen. And if we're constantly disrupting them by changing the structures, we simply won't get the big changes that our patients want. So change, not churn, absolutely vital. There's no doubt, you don't need to tell me the fact that strategic health authorities are as alien to many people in the NHS as the Department of Health, believe it or not. It is absolutely true that in the past, when managers have huddled together for warmth, and occasionally we do, we often talk about clinical engagement, but what actually we mean when you scrape across the surface from it, what we actually mean is getting doctors and nurses to do what we want. That won't get us the change. It simply won't deliver the change for us. When I talk about clinical leadership and clinical engagement, what I talk about is completely changing the nature of our organisations and our systems, that people genuinely believe that the system is there to help you improve services for your patients. And indeed, this system is completely organised in that way. It seems to me a fantastic mission. We've got a real opportunity now. We've done a lot of the difficult work. We've got I think, a compelling vision for the future. We've got to create the environment to give people the power to take it forward, and I'm absolutely committed to working with the Alliance and the NHS as a whole to make this a reality.